If you have a lumbar rectification, you should stay until the end of the video, because I'm going to give you the tools so that little by little you can correct it. A quick reminder about the spine. As you can see, our spine has an S shape with certain curves. Rectification is nothing more than the loss of this lordosis, this lumbar curve, which ends up becoming completely flat. The important thing about this rectification isn't so much the symptoms, but rather that it's a stage that comes before the appearance of discopathies. Yes, that's right. Conditions like disc protrusion, herniated disc, bulging, extrusion, or lumbar osteoarthritis. That's why it's vitally important to start working on these types of exercises as soon as we have a diagnosis of lumbar rectification. Why does this rectification happen? Usually it's caused by a sedentary lifestyle. Another factor that also plays a role is genetics. In any case, today I am going to give you exercises from the simplest to the most complicated, so you can work at your own pace. And improving this curvature is to finally recover the lumbar lordosis. These are exercises that cause certain symptoms, some discomfort, some uneasiness, but that doesn't mean you should stop doing them. In fact, these are some of the exercises I insist on the most, that even if you feel pain, you should keep doing them. That's why I want to offer you different variations so you can choose the one that best suits your abilities. To do this set of exercises, we're going to need a soft mat like this one, a hard surface like the floor, and a couple of cushions of different thicknesses. I strongly advise against doing it on the bed or on the couch, because the fact that those surfaces sink will drastically change the mechanics of the exercise. First variation of the exercise, we're going to lie face down, pay close attention, our feet can stay however you want. Some people place their feet tips like this, others prefer differently. Do whatever you want, okay? Because many of you ask me if one way is more correct than the other. The way you feel most comfortable is the right one. Next, we're simply going to lie face down and rest our forehead on our hands. This position, even though it seems very simple, there are people who find it very difficult and can't even hold it for a minute. All I want is for you to hold this for 5 minutes and try with each breath to let your lumbar spine right here sink and relax more and more each time. A key issue with lumbar extension exercises is constant tension in the lower back. We notice two very strong columns of muscle here that are constantly contracted, and that prevents our spine from sinking and working in extension. Rest your forehead on your hands, close your eyes, relax, and with each exhale, try. Bring your navel closer to the floor. This may cause some discomfort, of course, but it's okay, all right? That's what we really want to work on, that extension, bringing the spine to a position it has lost, and it's completely normal to feel some pain. Let's just do 3 breaths together so you can see. I rest my head, and it's important to rest your head because as soon as you lift your head, there's some contraction in the lumbar muscles. Stay relaxed. Inhale through your nose. Exhale and try to press your belly button and lumbar area down toward the floor. We breathe in. We breathe out. We breathe in. And we breathe out. This position has made you uncomfortable, but it's not entirely unpleasant. So now let's move on to the next level. Ideally, you should hold that face down position for up to 5 minutes, and even increase it to 15 minutes after a few weeks. The next level is to place this pillow right at the level of your ribs. If you touch your sides, you'll find your rib cage at the lower part of your ribs. Well, the lower edge of that cushion should line up with the bottom of your ribs. And let's go. Let's do the same thing. I lie down on that cushion, but now, since there's a small pillow, there's a greater extension, a longer lever arm. Basically, what we're doing here is lying face down, and then we're going to use different types of support. So that, as you can see, that spine goes up, 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 and gets worked exactly here, at the level of the lumbar extension, which is what we want to recover. Very good. Let's lie on that cushion. I get comfortable. Now I'm going to place my hands with closed fists because the head is going to be a little higher, okay? I relax my entire back, take 3 breaths, and try to bring my belly button as close to the floor as possible, so that there is the greatest possible lumbar extension, the greatest possible relaxation at the level of my lumbar spine. If the cushion bothers you, just raise it a bit like I did. Now let's take 3 breaths. You should hold it for at least 5 minutes. Let go. We grab. Let go. And with each exhalation, my lower back sinks down, my belly button gets closer to the floor, and my spine goes into extension. Last repetition. Let go. Let go. Perfect. Let go. You like this variation? It's comfortable and challenges your spine. You can hold it for up to 5 minutes during the first few weeks, okay? Don't worry, because we'll talk about the dosage at the end. If everything goes well with that thinner pillow, look, here I have a slightly thicker pillow. Same thing. Procedure, I place my rib cage, the lower area of my ribs, on the cushion, on that cushion. So now my chest, as you can see, is farther from the floor, and therefore there is more extension at the lumbar level. It's as simple as that. Now again, I place my hands in front, fists one on top of the other, so that my head is well supported. I'm going to try to relax, bring my belly button closer to the floor, and increase the angle between my chest and hips, so the lumbar extension falls properly. And I'm going to switch cameras so you can see me from another point of view. Let's take 3 breaths and notice how this difficulty feels. We inhale. We exhale and try to release that muscle tension, relax the tightness as if your belly button is sinking toward the floor. This point is very important, okay? We inhale. We exhale. One more. Very, very good. If it goes well, after 3 breaths, you can extend it to 5 minutes. Remember, it's essential. I know I insist, but it's crucial your head rests relaxed on your hands, as even slightly lifting it is enough. You touch here and see there's a lot of muscle contraction in the lower back area, but as soon as you rest your head, that muscle contraction decreases. That's why it's so important. What's the next point? Well, we could try with 2 cushions, okay? The same method? We basically place that thoracic cushion and lean on it, but now we're going to try something a little more challenging and different, which is basically the Sphinx position, where we're going to place our arms right in front of us, with the elbows well supported, with those elbows right under the shoulders. And from here, we're going to extend the head and look forward. Here we have to make an exceptional effort to relax that lower back area, since we can no longer rest our head on our hands. So try to lift your head up so there's less leverage. Try to focus, close your eyes. And here you really have to make an extremely special effort to bring your navel very close to the floor. So again, we're going to take 3 breaths, looking at the sound. And we could, for example, also move the forearms forward to make it gentler, or even further forward to make it even gentler. We have multiple levels, forearm forward and halfway back. All of them will increase or decrease the difficulty of the exercise. I keep looking forward, I take a breath, exhale, I try to relax my lower back as much as possible. This is much harder. Belly button very close to the floor, lumbar extension. I reduce the tension in that lumbar muscle. I inhale. We exhale. I inhale. We exhale. Very, very good. And I would stay in this position for 5 minutes or, I don't know, 30 to 50 breaths. It's important our head doesn't sink between the shoulder blades here, because that, in the long run, after 5 minutes can cause pain in the trapezius area, okay? Always try to keep a good distance between your ear and your shoulder. Very, very upright. Very good. How did you find this difficulty level? A little bit harder. Things are getting more intense here. Well, there's an even higher level of difficulty, and it's basically about doing repetitions, extending that lower back area. As you can see here, the extension we do at the lumbar level is already very, very high, and it's not for everyone. At this point, the important thing is that the pubis, the pelvis, doesn't lift off the floor, and that the lever arm is made here so that our spine rises. There are different difficulty levels based on elbow placement. Placing your elbows further forward increases the challenge, as mentioned earlier. Less range of motion, okay? You can place them further back for a greater range of motion. This is quite a high level of difficulty. It's not suitable for everyone, and I recommend you use it only after you've completed at least 4 weeks of lumbar extension work. Now let's get into the dosage. For example, begin by lying face down. Work for 5 minutes daily, then next week increase both difficulty and time by 5 minutes. So that the second week you'll do 10 minutes, for example, with the cushion under your chest. The third week you can do 15 minutes with your arms in the Sphinx position, looking forward if you can hold it and it works well. And in the fourth week, can we introduce the extension movement on the arms? It's not a movement that should be done individually. Instead, you should stay for your 15 or 20 minutes on your forearms. And then, at the end, we do 10 repetitions of lumbar extension. They're like the cherry on top of the cake, that extra touch that we add to our back to do a very, very effective and very intense job to work on that lumbar extension. Now imagine that in the second week you already have some pain. Well, then don't add more minutes, don't add more. The difficulty, your symptoms will always be the key guide that will let us know if we need to increase or decrease the difficulty. After finishing your lumbar extension exercises, remain lying face down for a few minutes and relax instead of getting up immediately. Next, lie on your side calmly, also for a couple of minutes. We do this because moving from extreme spine extension to standing can be uncomfortable. It's about returning to normal life. The discs need a little time to get used to the change in position, okay? And if you get up too quickly, it might even feel more painful. Then we lie on our backs. This one feels good, right? And finally, we sit up. Very good. So you should do these extension exercises every day, starting with 5 minutes, increasing by 5 minutes each week until you reach a maximum of 15 to 20. But I know that many of you can't, for example, lie face down at work or at home. You don't have the time needed to do this, right? So I'm going to give you a standing alternative, which is also very, very effective and will also help you improve that lumbar extension and fight rectification. And in this last variation, all we're doing is replicating the extension movement we've done on the floor, but this time standing up. How do we do it? It's simple. First, we're going to locate our iliac crests here. That is, that bony ridge, that prominence that forms our waist. Place your thumbs on each side of the spine and look up at the ceiling. We look up at the ceiling, push forward with our thumbs, hold the position for 10 seconds, and then relax. If you have cervical issues, you can skip the extension and just look straight ahead while leaning back. Is it a good alternative? It's not as effective, as you'll notice if you try it at home, but it's especially useful if, for example, you work sitting all day and need to release your back and work a bit on lumbar extension. Let me move this arm so you can see it better. Starting position, thumb at the level of the spine, push forward. There's no secret to it, okay? It's simply about working on that extension, regaining our lumbar curve to go from a completely flexed and straight spine to one with a good lordosis. Okay, let me remind you that we have a special video where I truly show you if you're making the right decisions when it comes to rehabilitating your herniated disc, your lumbar straightening, the condition of your spine. And for that, I simply invite you to go down to the comments and click on the link I left in the first comment. Leave your email again to receive it completely free in your inbox. That's all. I'm really glad you made it to the end of the video, and I hope you can share it with those who need it. I have already done my job. I've shared my knowledge with you. Now it's your turn to share that knowledge with the people who need it. This way we can make physical therapy accessible to everyone. Best regards, and I hope to see you in another video on the channel. Bye, friends.